Tonight on Cox Forum.
In the aftermath of the shooting of Representative Giffords in Arizona, it became apparent that the young man accused of shooting her and killing 6 others had been exhibiting what many have called some warning signs while he was in a local community college. It pointed out some of the issues that are faced by folks in colleges when they are dealing with troubled students. We'll be taking a look at those and some of the other issues involved with dealing with mental health in America tonight on Cox Forum. We are speaking with Dr. John Caccavale. He is the co-founder and executive director of the National Alliance of Professional Psychology Providers. And one of the things we started to talk about is the fact that the way the system is set up right now, you feel that it is pushing physicians to try to treat psychological issues.
Yeah, I mean, that's exactly what the system is right now. I mean, 80% of the scripts, the prescriptions for psychotropic drugs are written by primary care physicians. So when you take a look at those numbers, those are very high numbers.
And how does it compare in the past?
In the past, primary care physicians maybe 2 to 3%.
Mm-hmm. When did that change?
It started to change with the penetration of managed care into the healthcare system. And full force from 1998 and from 2004 on, I mean, all mental health and behavioral health has been transferred to primary care.
Mm-hmm. So is there a place for medication in dealing with mental health issues?
Oh yeah, I think that a case can be made for about 12% of patients. Medication may help, particularly if it's given alongside psychotherapy in combination. But that's a very small number of people. If you look at the advertisements and the absolute use of medications, we're looking at billions of dollars. We're looking at unbelievable amounts of time and effort and not getting much out of it. But yes, there is. With appropriate evaluation and diagnosis and looking at psychotherapy as a first-line treatment for these disorders, you could see if a person is progressing. You can see if they need an adjunct therapy or they don't need something at all. But yeah, I think that for certain types of disorders, medications can be helpful.
Now, but how can you tell that? Who's the one who's going to decide that?
Well, you're looking at professionals who are trained in this area along with the patients. The patients give you the best information. If a patient is not getting better after several sessions of therapy, you have to take a look and see, why aren't they?
So what you're saying is instead of having the primary care physicians as the first line of dealing with mental health issues, it should be psychologists?
Indeed. I mean, the research is very clear on that, and that is that medication should not be a first-line treatment for behavioral disorders. I mean, the research is so overwhelming at this point that even the theories that the medications are based on now, drug companies are trying to move it to a different level of explanation.
So why does it continue then?
Marketing. It's a big business. I mean, we have in the Congress under the Bush administration, they passed a $400 billion drug bill. We're talking lots and lots of big money, and this is what drives healthcare.
What do you say to people who say, oh, these are psychologists who've seen their businesses drying up because it's going to primary care physicians?
Oh, I think that, clearly, I mean, there's a self-interest there amongst any profession, but we have a symbiotic relationship with patients. In other words, you cannot have a mental health system without having providers. And it's true. Psychologists would see practices grow if we went back to the system that we had that was more effective than what we have now. But the patients would gain, and so would the country, because the costs would decrease in terms of overall healthcare costs, and we would see a quality care system versus one that is not quality.
Well, let's take a look let's step into the patient's point of view. If they feel they need counseling, are they able to do that right now under the current system?
Sometimes they're not. Insurance companies have extremely onerous utilization and authorization practices. The other thing is that physicians will see a patient, write out a prescription, and probably will not see that patient for 2 months down the road.
So much of the criticism that's pointed at the drug companies are saying that they're marketing to patients because patients will go and push ideas on the doctors, and the doctors, just to get out of the office, will write the prescription form. Are you trying to kind of turn that around and have patients go in and ask for counseling as opposed to
yes,
drugs?
Absolutely. That's part of our campaign with the Truth in Drugs campaign, and that is to provide information to patients, number one, on what the best available research shows. And just as the drug companies would motivate them to go to a physician and ask for a particular medication, what we're saying to them, you would do better to demand from that physician that you receive an evaluation and an appropriate diagnosis first. And the reason for that is that right now, with the research that we have about what takes place in primary care, it takes an average of 5 years before a primary care physician will actually get the correct diagnosis for depression for the average patient.
Well, why is that? Why do you say that?
Part of the reason is a patient will come in and will have a lot of complaints. Physicians deal with symptoms. So if I'm having problems sleeping, well, let's do an MRI and make sure that you don't have a brain tumor. I have a headache, let's do an MRI or CAT scan. Well, all of this takes a lot of time. You do blood testing, you do this, and finally when they don't find anything physically wrong, then they attack each symptom. So if you're having problems sleeping, what we'll do is we'll give you a benzodiazepine or a Valium type of compound. If you're having trouble eating, we'll give you another pill for that. And so each symptom is addressed in its own little box. And when you're dealing with behavioral disorders, you have to look at the big picture. You just can't look at just sums of symptoms. And so in primary care, given that the family physicians do not have the time nor the expertise or training to do these evaluations, they attack it as a medical problem. And so therefore patients, it could take a very long period of time and extremely expensive before someone gets it right.
So who exactly is Truth in Drugs aimed at? Who's your primary target in this campaign?
There are two targets, the public being the first one. And again, to educate the public about what would be the best available practice for them to get the best treatment, and also to physicians. Physicians, of course, may not like the idea that we're saying, if you have depression, being treated by your family physician may be hazardous to your health. But again, if you take a look at the research and you take a look at what is taking place, that's an extremely accurate statement. And so we're looking for both physicians and we're looking for the public, but also hopefully some policymakers might take a look and see what we're talking about, that the cost, the overall cost for the healthcare system in this country, that's where the real waste is, treating people for things that they don't have with services that they don't need.